Yes, maybe at the beginning a few words about what our institute is doing, because actually Fraunhofer is not one institute, it's a whole association. We have more than 70 institutes in whole Germany. There's even Fraunhofer Austria, so Fraunhofer is even here. And our institute is basically developing intelligent systems, so we are developing different kinds of technologies. We are working in the fields of speech and audio technology, video recognition, semantic technologies, question answering, also text analytics, where I will talk a little bit about big data infrastructures and system modeling. So we are doing a whole bunch of things, always in the center, of course, machine learning, algorithms and approaches. And yes, so to maybe start, so we are working in different areas, different branches, and one of them is of course the healthcare sector. And maybe to explain what the trend for us is of artificial intelligence in this field. And basically I have this map here for you. I'm not sure who of you knows this kind of map already. So here you basically start with the classical data-driven approaches. So you have well, it can be big data, but doesn't necessarily need to be. You have lots of data, you have not so much knowledge, and you can use the basic data-driven approaches as classically used. You also have the so-called no-chance area. Maybe this is not completely true, there are ways, but if you have small amounts of data and less knowledge, then there is basically, it's very difficult to use machine learning in this field. But it gets very interesting if you have much or less data, but you have a lot of knowledge. And so you are able to basically improve what you're actually doing with your algorithms, or you even open up new possibilities because you don't have that much data, which is actually true for the clinical data. And but you have a lot of knowledge, and we're combining this knowledge with the analytics, for example, via informed machine learning, hybrid AI. There are many different words for this. You can improve your analytic results. And why is this fitting to the healthcare areas? Basically because you have data, maybe not big data, but you have data and you have a lot of knowledge. And this knowledge is basically hidden in different kinds of ways. So classical data would be, of course, like clinical data. If you're lucky, they are already in a kind of electronic health record system, so they are structured, but basically the quality is, it depends. And usually we say as data scientists, 80% of your time you're just dealing with checking the data, making the data ready for analysis, and the analytics part is like something like this. You also have sensor data, like a lot of data is collected nowadays via smartwatches, smartphones, and so on. But you have something like medical letters, for example, or reports, which contain a lot of information about the patient, but this information is not structurally available. You also have a lot of knowledge and experience hidden in the medical experts, doctors, which is not usually written down. They have a lot of experience, they know which therapy works for which kind of patients. This is very valuable, but not always accessible. You also have, and I think every one of us knows this, a lot of papers and studies coming out, and even for your special field it's very difficult to be updated, to know all the papers which are coming out. There are even conferences publishing papers, new kinds of publication platforms, so there's a lot of going on, and the challenge is really here to be up to date. And of course you have further external knowledge via the World Wide Web, so much is accessible right now. And these are the challenges we are dealing with today. And there are two basic questions coming up with this. First is how to store knowledge and data together. And the second is how to access knowledge from, for example, documents. And the first example I will give is a very nice technique which we are using in our institute to basically store knowledge. And one way to do this are knowledge graphs. So basically, sorry, because of the light, it's a little bit difficult to see, but it's not that important, but if you want, okay. Yeah. So basically, you see here, or you should see in a few seconds, a large network. In the center, for example, is a person, and you have connections to other persons, which are here in orange. So two more persons. Okay, take some time. And basically each of these connections, so these so-called edges, they represent a relation. Yeah, so it takes more time than expected, but I hope you can follow me. They are related by something. For example, you have here you have here a boss of a company, for example, and this person manages other people in the same company. Or you have a person who is a member of a society, and the society you have also other members, and so via this node these two persons are basically connected. And this is a very natural way of representing relations. These networks can become really, really large. So for a human it might be really difficult to read it, but for machines it's very easy. So the advantage here is that it's very easily readable by machines, and this is why it's a very great input format for machine learning techniques, for example. And I think every one of you got already in touch with this, because I don't have to mention this very famous search engine, and of course this example is a little bit biased. So if you type in my name into this search engine, you won't find me. You will find this very nice person here, who happens to be a very famous designer, at least in Germany. I'm not sure how famous she is in other countries. Basically you get here the first top entries relating from your search, and what you get for many of the results, not for all of them because they need to be represented in this knowledge graph, is what you see on the right side. And by this icon you see, okay, this is the result coming from the knowledge graph. And usually the first entry is the Wikipedia entry, because this is what most people click when they search for a person. And you get the you get also other people being in relation to this person here. So other designers, unfortunately Karl Lagerfeld just died recently, or you get even books about this person or books written by the person, so you know how these people are connected, and so this the search engine basically jumps through this knowledge graph and extracts the information. And these knowledge graphs are one basic technique which are used for question answering methods, for example. Another way is to extract knowledge, very important techniques. What we are doing in our institute is natural language processing or text mining, and I would like to explain this according to one example project we are doing, which is funded by the Ministry for Education and Research in Germany, where we are together with many different partners, and our task in this project is to basically extract information from literature, combine this information with the patient cohort data we have in this project, and also some expert knowledge, for example treatment guidelines. And these are then integrated into a graphical user interface, which is programmed by a partner in this consortium. And then what happens is, because now the development phase just ended last month, and now the translation phase is starting, so this system will be applied in the clinics, set up and applied. What happens is if a new patient is coming in, all the information from the literature and from the previous patients is used to optimize the therapy decision support. So to support the doctors. And I just want to emphasize, like the speakers before, we don't want to replace anybody, we just want to support to make the decisions. One method we are using, which is not directly going into decision support, but which can help to just get an idea about what the disease is about, are these so-called topic graphs. So you see this in the video here. You specify a certain number of topics and a certain number of words, and then the neural networks, they just calculate this network based on the bunch of abstracts you're putting in. And what you then get are these topics and the words which are like representing this topic, so which appear a lot in the documents you put in. So here the input was just all papers from PubMed containing the term colorectal cancer, which are then displayed here. We also added some highlighting now and also some timeline. So by this you can basically just screen through these abstracts in a very structured way and just get familiar in what is going on for this disease. For example, we found a chemotherapy topic or a gene mutation topic and so on. The second we are using is to really extract information directly from literature. So one important question was that we find therapies which are applied to colorectal cancer, and where a biomarker helps us to decide to which cohort this therapy could be applied or not, so where it works or not. And basically we are doing this using name entity recognition and relation extraction, which just means we extract certain entities from the abstracts, and it's not like string matching, so we really try to learn from the context what is a gene, what is a biomarker, what is a therapy, and what is a disease, so that we can also learn this to find new therapies. And then we just extract this information. You see that the treatment was applied to this cancer. So we try to find these triples, and these will then highlight it in the graphical user interface as a support to say, okay, maybe for a certain patient this therapy could be interesting, so please have a look at the abstract. So we don't take over the decision for the therapy, we just present exciting studies which could be interesting for the doctor. So with this, I would like to thank you, and I'm looking forward for the questions in the panel discussion.